All right, we're recording. Hello, everyone, and welcome back for a long overdue episode of Interviews You Didn't Ask For, where everyone on the show is someone I know. And if you know me, you have at least heard of my guest today. He's a returning guest, John Charles McCoy. Hello, welcome.
Hi, everybody. How are
John
we
is
doing
joining
today?
us from the other room.
Yes, from the other room.
Um, we decided to do this interview today because we just went through an ordeal. Um, we both were exposed, and at least one of us contracted COVID. And if you know me and you know John or anything I was saying through the whole pandemic, it was my biggest fear because John has a lot of health issues. And so this was probably the hardest 2 weeks of my life, the most stressful, the most scary. And we want to talk about it, not just to talk about what happened, because I don't think it's like unique. All these people have gotten COVID, but to talk about how we navigated it as, with John having several high risk factors. And I'll let him explain what he wants to share, as well as being Black and recognizing that there's hidden things within the system that we utilize to get us over this hump. And we wanted to share those things as well, for folks out there who are minorities, who are high risk, in the middle of a pandemic where clearly no one gives a shit. Like people are just running the streets, like we're not having one of the largest surges the state has had. So, before I start digging into all that, I'm going to actually pass it over to John to share, um, just kind of what happened and his experience and all of that.
Well, one foremost importantly, I want to say thank you to all the people who did know and that did reach out, their friends or family, even my wife's coworkers who reached out to us with all your prayers and support. It was very, very thoughtful. It was very, very meaningful. So I want to get that first and foremost off my chest, and also to the Lord. Okay. Um, Second off, I also want to say thank you, Jazz, for having me on your show again. Um, that introduction was a little bit on the, oh, where'd she go? Okay. Well, I wanted to say the introduction was a little bit on the weird side because for a hot second, when she said we were going through ordeal, I thought it was we were going to talk about an entanglement and we don't be doing that kind of stuff in the house. So just wanted to make that sure. Um, but like she said earlier, these last 2 weeks or so have been different, very, very rough, has been a large roller coaster when it comes to emotions and trying to get stuff planned and trying to get things figured out. And I think probably one of the bigger issues about it is that this disease affects everyone so individually and specifically, where the symptoms that I have are not necessarily the symptoms that you have, and the symptoms that you have are not going to be the same symptoms that your significant other has or whoever else in your household has. And so it makes for planning, strategizing, figuring out your next steps that much more difficult when every day could be something different from the day it was from the day before. So even like the little things, it's like, oh, okay, I'm feeling a little bit bad, but it's not progressing that much worse. When I wake up the following day, yeah, I'm gonna go ahead and go to work. I'm gonna go ahead and, push forward a little bit. And then you wake up and you're like, okay. And then just like that, something hits you and now you're taken out for the rest of the day. Um, for me personally, it was quite terrifying. It was quite terrifying. For those who do know me, I've been an asthmatic since birth, almost. Um, I have high blood pressure. I am obese, and just in recent, I've came down with congestive heart failure, which on a more positive, upbeat note, because of the prescriptions and medication and my wife's assistance, a lot of damage that has been done to my heart has been reversed. And once again, thanks to her and all her vegetables and herbs and gardens and wiggly fingers that she's been doing for the
Oh
past
wow.
couple of couple of weeks, I just want to say thank you for that. But like I said, I did have a lot of health issues, and because of that, for that whole past year in 2020, I we took every single precaution. Stopped going to work. If I did go to work, very regulated hours, not dealing with that much within the public, not going places, not seeing friends, not seeing family members when I wanted to, just because, the idea of keeping not only myself safe and them safe, wearing gloves, wearing gloves and wearing gloves and masks every time they were going out, covering up. There was a brief part in the beginning part before we knew exactly what kind of mask you could get, or they were like, well, you can wear this kind of mask, you wear this kind of mask. I had a regular painter's mask and a bandana that I was wearing on my face. So we wiped down every single thing that comes from the outside to the inside of the house, whether it be mail, groceries, packages, doesn't matter. And it only takes one.
Yeah, I just I think anybody who has interacted with me or us knows that. I mean, we're the people who do not take chances. I would say the risky thing I did most recently, which is the first time I've done it since 2020, since the pandemic, is I about 3 or 4 weeks ago, the weekend before Easter, I went shopping in a store and tried on clothing. And that is the first time I've tried on clothing in a store in a year. We don't go to restaurants. We double mask. We wash our hands. I can't tell you the last time I've been in a group of people, like in an enclosed space where it was more than, like, counting John and I, 4 or 5 people. Um, we've like, I can really go down the list, and I just want to reiterate that we reheat food. We have not used DoorDash or any type of food service till now, because it's like, why bother? But um because we weren't sure about what was happening on the way, like, literally still wiping down groceries, taking off our clothes and shoes when we've been outside or anywhere. We did all of that. And one of the things I do want to make sure that we talk about today is that I think there's, for better or worse, some misunderstanding about how all of this works. And that, I would say, even for us, because again, you think when you're taking all these precautions, and I think this is the important part, that you make assumptions about the people that you decide to be around. That's the issue. So you can do all those things when you're out in public because you don't trust people out in public, but it's when you are at home or in someone else's home where the problem is. But I'm sorry, John, go ahead.
No, no, that is a excellent point, that um, that you do need to be cautious about your bubble that you deal with right now. um, and you hate to necessarily think that way, that there are people out there who, even loved ones, who you definitely care about, who's like, yeah, I wish I could see him more often, but because of their actions, whether it's like they like going to the store every single day because they have nothing else to do, or because they are missing that human interaction, that they're willing to go ahead and put themselves out in risk. And for those who, what's the nice way to say it, don't have um, the wherewithal um, to
What are you
do.
trying to say? Just say
I'm
it.
just saying, for all the ones who, for all the ones who have family members who don't believe that this is a thing.
Ah, yes, yes. I mean,
Yes, I was,
that's
I was, I was
make it
trying to.
plain, because I think we all know people who do not take this seriously. And I
Yes,
know we're in an individualistic culture, so it's really hard to get people to give a shit about anybody else. Literally, I've heard more than once, like, it's
And
my,
it's,
your health is not my responsibility.
but it's so, and that among itself is just about as a statement of necessarily of how weird and selfish we've become, that we do not care for our other fellow human being. But I'm even referring to people within like your own family. I have heard so many of like friends and past coworkers who come from a different walk of life than I do that have said like, their parent who has it doesn't believe that this is what it is because of what somebody from another TV network said about what was going on, or having actually someone pass away because of COVID-19, and then still it being the political thing and having family members not protest, but like refuse to come to the funeral services because that's not what my father died from. My father didn't die from COVID. He died from lung cancer.
I mean, there's so much, and I think we will dig into it about the medical system, privilege, all of that. But John, my question is, what
Hmm.
happened to you? What was the situation? How did this occur? I mean, I know, but for
So,
anybody who might be listening, our three viewers.
so for anyone who's listening, for our three, um, I did test positive for COVID, and it was a very touchy situation. There were a lot of things, both physically and mentally and emotionally, that I had to deal with that I was not in the mindset of ever dealing with.
But
Although I
how,
have,
you don't have to give a whole lot of details, but like walk us through, like, what happened? How were you? We're careful. How did you get exposed? How did we respond, to finding out that time frame, all of that?
so um, we found out that during a family gathering that somebody uh, had gotten sick from that family gathering, and from that, um, some of us had contracted COVID. Now there were some who didn't, and we pray for their health and well-being, that nothing happened to them, but some of us did. So
And
it
I
is kind
want
of
to
what it
point out
is.
that, it's this, there's nothing in here where it's like someone actively knew that they had COVID.
Right.
The problem is, and this is something that folks need to understand, is that you are one of the times you're most contagious is right before you show symptoms. So again, when you are doing those temperature checks and blah blah blah, it doesn't matter. I'm not showing symptoms, but I'm highly contagious. And so it's not even about like being malicious or thinking someone was irresponsible. Now, mind you, there are definitely people who are aware they have COVID, going into public places, open mouth coughing into people's face. But I'm saying that a lot of times folks don't know they have it until after they've exposed people and they're contagious. And it's not malicious. And I think that's important to
Right.
outline.
Right. So this wasn't a situation where this had malicious intent to it. This was not a thing. Because I don't. No, I'll take that back. But um, I don't believe that this was done out of maliciousness. Because no. And so once the word came out that um, once the word that came out that this had happened, and then the family kind of rallied and was like, okay, we all need to go ahead and get tested to make sure where we're going. And then that's when, not the miss of information, but that is when, because there's so much different information that's out there, that's when things starting to get a little bit on the wonky side. Like, when should you get tested? How often should you get tested? Like, what's the day rate and the day frame? Day frame. Like how long should it have been from the actual day? They said like, hey, the longer that you wait, the better that your test
The more
results
accurate the
more
test would be.
accurate.
Yeah.
Right. So we ended up waiting, I say like 5, 6 days.
We went on the sixth day.
We went on
My
the 6th day.
recommendation, I want to say, because we're going to talk about privilege a little bit. One of our saving graces is that one of my friends that I've known for a long time, who also knows John, act like you all know her. works with COVID cases, and that was the first person I called as soon as we found out. We, before symptoms started, before anything, as soon as we found out, I started planning. Like, what things, I needed to plan A, B, C, D, E, F, G, H, I, J, K, 1, 2, 3. Like, I needed all the plans. And so she's the person who instructed us to wait 6 days, to make sure that we're not getting a false negative, because a false negative meant that a lot of the plans we had, and we'll get into that, couldn't work. And if you have a person, if you have a loved one who is high risk, you or yourself, a lot of the things we're going over that we did, I really want to share, because I think it helped us a lot. There's one big thing, but there's definitely other things. Like, the first thing I'll say is, along with talking to her, I placed some orders. I placed some orders for something that John is tired of every morning, a bowl of vitamins that we both take. I'm not kidding you. It's like 8 or 9 vitamins.
Yes, it's a lot of vitamins.
And teas. So we start every morning. We didn't do it this morning, with a shot of vinegar and water. And then we space it out because John is tired of me giving him beverages. But I bought a bunch of vitamins and a bunch of teas. I can share that list as well. But one of the big ones is, I'm gonna tell you, these numbers sound high, but I've shared this with John's doctor, so she's aware, approved it. But one of them is vitamin D. Vitamin D is supposed to be really good to help with COVID. Also, when you think about the fact that Black folks tend to have, you know, vitamin D deficiencies, we are and we're taking over 10,000 IUs of vitamin D, which is a lot more than the daily recommendation. Just, let me say, warning, we are not medical professionals. The doctor did ask me, was I one? But we are not. So please don't say, don't come back and be like, y'all lied to me and now I have vitamin D poisoning, which I don't know if that's real. But okay, so we found out, and that's when, like, a bit of the panic set in, and we got tested on the 6th day. Go
Right.
ahead.
Um, and up until that point, it was kind of like a little back and forth because, like I said earlier, I do have asthma, and that was one of more of the bigger concerns um, that because of COVID, it does such havoc on the lungs, and my lungs are um, already at, I like to say, at 0.5% to begin with. Um, I know that wasn't going to be a good thing. So more just like, kind of keeping me like calm and, kind of keep everything together. And also trying to keep my mental state from my family together. Like, I can't start freaking out because my wife's going to start to freak out. Worry about that.
I
And
freaked out anyway.
and it also didn't necessarily help to go into worry and stress because we did not have any of the test results back. We didn't have anything back. I wasn't starting to feel any like direct symptoms of yet, but due to the nature of some of the COVID symptoms, a lot of those symptoms tend to kind of blend over into your regular asthmatic symptoms, hay fever, and definitely with stress and being constantly worried that something is happening that you're trying to figure out, what's going on within your own body, which I will say is a weird kind of silver lining. It did help me process um, it did help me process and understand the symptoms that I was having so I can better explain to the doctor certain things. Like, if I'm over anxious or if I have some anxiety that's happening, I'm feeling a tightness in my chest. Before, it's like, oh, I'm just having this tightness in my chest. But now I have an understanding, like the tightness that I'm having in my chest is coming from the outside in. That tightness is coming from the muscles around my lungs being squeezed because of my stress. When I'm having an asthma attack and I'm feeling that tightness from my chest, it's becoming from the inside out. So this forced me to be a little bit more cautious, more aware of my own personal body and not just giving blanket statements like, oh, my legs hurt. Well, how do they hurt? Is it a burning? Is it a stabbing? Is it a pins and needle kind of feeling? Do they hurt when you touch them, or they just hurt just in general?
Well, John, let
Um,
me ask you a question, because I think this is also a misnomer, if that's the right way to use that word. the symptoms that people know about COVID are fever, headache, cough, shortness of breath. What symptoms did you actually have as a person with asthma and high risk?
No, I did not ever have a fever. I did not have a fever. Um, but I did have shortness of breath. And I had the shortness of breath. I didn't too much have a cough. Didn't have too much of a dry cough, but because of my
I had more of a
medication,
cough than you.
because of all my medication that I was taking, it probably was a little bit more of a suppressant. Um, but definitely didn't that. But the thing that was more alarming to me was the shortness of breath. Like if I would get up and then walk from the bedroom to the bathroom, um, I was pretty much done by the time I got to the bathroom. And then if I was going to go back from the bathroom back to the bedroom, yeah, completely done. I
I,
also had
Go ahead.
no, I was going to say I also had some body and leg pain.
You didn't
From
have a headache.
damn, didn't have a headache. Um, from I guess from my knees down, felt like just being stabbed a bunch of time repeatedly, like little pins and needles.
Like
And
when
it
your
was
foot falls asleep?
um a little bit, but a little bit more painful.
No,
Like when your foot falls asleep, it's more, annoying. It's like, we smack it a couple of times, you start to get some, feeling back. This one was that the difference between the pins and needles feeling when your foot falls asleep is that your foot's numb. My foot wasn't numb. I could still feel everything, and then I could feel the pain even more. If that makes sense.
So, a couple of things. First, we should probably establish the fact that only one of us actually technically tested positive.
Yes.
I tested negative. I think it was a false negative because I started crying when they did the test, and I freaked out the nurse, so she only swabbed one nostril. I also have been I was exposed at the same time as John. I have been in the house, despite I'll say this family was like, oh, put on a mask, put on a mask, quarantine. But when I talk to the folks from the state, they're like, yes, we tell people to do that. But in reality, and this is something to consider too, if you have like if you can't quarantine from your child, especially if you're their only caregiver. Our situation, we have one bathroom and there's really not anywhere for me to go. And unless we really were diligent and John only stayed in one room and we wiped down the bathroom every time he used it, cleaned it thoroughly, that would be the only way it would work. But that just was not something we could do in our home with one bathroom. But I want to point out that the assumptions that we make about symptoms. So even me, let's just assume that it was a false negative, or if it wasn't, I've clearly been exposed a lot. I probably had the most symptoms, but they all seem psychosomatic. Like when I think about the word cough, I cough, but that's it. I did have a headache yesterday, but John and I could both walk into a place at any point during this where they're screening for fevers, right? Checking your temperature and be good to go.
Yeah.
Actively, have COVID and good to go, which is one of the reasons why testing is important.
Actually, was weird is that I didn't have that much of. Not only that, I did not have a fever, that my temp was actually a lot lower than what was the norm. And when I say a lot lower, like it was, what was it supposed to be, 97.8 or something like that?
I don't know. That's what that gum commercial said.
Yeah, I was running like a 96, a 97.1. So I was running relatively low, which the doctors and all said was fine. Um, but because of my asthma, they did want me to make sure and check my pulse ox. And that's one of the things I wanted to get back to, um, is about how different the disease interacts with everybody. Like there are some things where people saying, hey, yes, check your temperature. You need to make sure that you're checking your temperature. That's one of the good deciders to essentially see if you are infected. Because of my asthma, they did not care at all about my temperature at all. They were trying to make sure that my breathing and my oxygen levels did not go under 90%, because that was a danger red flag for them. And I feel like that's the kind of information that we kind of need to know. Like, yes, across the board, these are the symptoms and these are the things that you need to be looking for. But for specific individuals that, hey, I have this specific health risk. What are some of the things I need to be looking out for? I think like that's the kind of information that needs to be more widespread or be more open and available. Now,
I
true
think,
enough,
I'm sorry, go ahead.
I was saying true enough, it might be already out there somewhere, but I don't think it's in.
It's the information is overwhelming and it all seems to be like different. Like, one thing will say one thing, something else will say something different. I feel like if you are high risk, especially if you have something like asthma or diabetes or anything like that, and you go out into the world on a regular basis, you should be getting tested on a regular basis because the key to this is knowing in advance. It's little things like I said, the amount of vitamins that we were taking immediately as soon as we found out we were exposed. One of the things we did is we stopped eating anything dairy based. This isn't some hotep, Dr. CB, whatever stuff. Literally, it's one of the things that irritates asthma. So we you can look it up. Plenty of people ask any asthmatic. A lot of people are aware, John, you were aware even before this, as a man
Yeah,
who loves to chug milk,
and
that it was
cheese, and
not good for
cheese.
your asthma. You knew that your asthma was better when you didn't have it. So it's one of the first things we did. But those things make a difference instead of waiting until you feel symptoms, but to start doing those things now, right?
Being preemptive, yes, being
Yeah.
preemptive, getting some stuff necessarily taken care of as best you can. But I also feel like it's one of those things where it's like you can't you can make plans or you can get some kind of stuff in order, but until you know what you're really dealing with, then that's kind of like where stuff necessarily kind of falls through.
So what symptoms did you experience and in what order?
Um,
And
I
like what
was
day from exposure? Like what was that like?
I feel like I was starting to have more body pains. That was the first one. I started having more body pains than anything else. Um, and then I started noticing um chest pains, but only when I would lay down, and only if I lay down in a certain position. If I lay down on my back, or if I rolled over onto my side, I would get this horrible pain in the middle of my chest, and then I could hear this gurgling noise when I would like take a breath in or take a breath out, and it's the same kind of gurgling noises that you hear when you have pneumonia, or it sounds almost like that a dirty bubbling teapot kind of thing. It's like a teapot that has like resin in it, so it's like you can hear it bubbling and surging, but it feels sedimenty, it feels heavy. Started noticing those, and then after that, that's when I started noticing like my shortness of breath, my asthma not being under control as it used to be, which um, had been under great control up until that point. I started noticing how I had to take breathing treatments a whole lot often, and it wasn't that many days. That's the other thing about it. It wasn't like this was like a long stretch of time where it was like, okay, one day I'm feeling this, and then I'll go back to fine, and it gets worse. I mean, like it was just a constant progression of like, okay, yeah, this is getting
A
serious. Like this,
decline, a constant
yeah,
decline.
a constant decline. Um, it didn't. Um, I didn't go after I got the positive test results back. It was a little bit. Was a little disheartening. It hurt. Not gonna lie. A lot of feelings, a lot of emotions
I had a
uh,
panic attack.
went through my mind, and it was a lot of things to necessarily deal with that I never thought I would ever have to deal with. Um, from the oh, I'm going to be sick for a while till I might be a long hauler. If I am, do I want to like? How do you want to necessarily live that life? To am I not going to be here anymore and leaving my wife here a widow, or just not being here? That's not, or my wife being a widow and not having the family around and all that kind of stuff. Um, it doesn't necessarily help that I have a job at the moment where, although I'm not supposed to hear this kind of information, I do hear this information on an everyday basis, where clients call and they tend to hear my voice and it sounds real smoothing. So they unload. They tell me all types of things about how their uh, sister at 76 years old got kicked out of their house because their daughter didn't like the fact that she was wearing a mask all the time and kicked her out because she believed that she was one of those. Her daughter was a QAnon person, and so they kicked her mother out. And so her sister's like, I can't afford to take her in, but I'm not going to let my sister be homeless because her daughter's acting crazy. Or having a woman crying because she she needs to go get her checkbook, but she left her checkbook upstairs. And before 2020 and COVID, she was running marathons. She was a full-blown athlete. But now she can only take 5 steps before she gets winded. And if she stands up for 20 minutes, she has to sit down because her legs feel like they're on fire. And it just, you hear those kind of stories and you're like, it's a lot. It's a lot because you don't know how to plan for that. You don't know what to accept for that. So you can only just kind of like, not blindly just move forward, but it is a little bit difficult. Um, I'm pretty sure if I didn't have Jay here with me, it probably would have been a whole lot worse. Um, if I didn't have the support system that I have set up between um, my family, her family, extended friends and family who were looking out for me and praying for me and sending their prayers, that things would have been a whole lot worse. I'm not gonna lie to that, but it still doesn't remove the fact that it was a very hard touch and go time. And looking back at it, I'm just now realizing about how bad the situation could have been, but also how short the situation was. This wasn't like something that was like long and drawn out over a long period of time. It was this is what's happening. Okay, we need to wait to make sure. And then this is what's happening. Then this is what's happening. Then this is what's happening. And it seemed like you said, every day there was a constant decline, but there was a constant decline with a ramp up. That every situation was building on something a little bit worse.
So, because I want to point out that, we found out I had a panic attack, started trying to put plans in motion. The first thing we did was set up an appointment with his doctor to enact one of those plans, because my prayer was that we were negative, but my plan, kind of like C, was that if we were positive and he had symptoms, but you got to be preemptive, was to get him an infusion. So this is one of the big things. If your family member is high risk, please listen to this part. My friend shared with me that there is an infusion. Honestly, I think it's what the former,
45.
45, thank you. I didn't want to call him anything rude. Got. And it's, at least it's in Michigan. She thought it was only in Grand Rapids, but once she told me what to look for, the day after we found out we were exposed and she told me that, I immediately started making phone calls. And I called University of Michigan. They do the infusion, but only if you live in Washtenaw County. This life-saving infusion is only for people who live in that area. You can go there with a referral from your doctor. They will turn you away. So that's just good to know. But I ended up calling the hospitals and getting their infusion center and getting information about how you qualify, what you need to do. And so, in order to qualify for this infusion, it's an antibody infusion. You have to test positive for COVID, have symptoms, have had these symptoms less than 10 days, and have some of the morbidity factors. One of those is age. Obviously, John did not fit the age, but they look at BMI, which is your body mass index, so your weight. And they also look at if you have any type of chronic illness. And he has obviously a list of them. So when I talked to her, I said, it sounds like she said, it sounds like he qualifies, but she doesn't make the decision. So you have that criteria. Your next step is to contact your doctor and get the referral from your doctor. And let me also say, as I noted, you can get the referral and still be denied and not get the infusion. So there's more steps in that involved. But let's talk about that piece when you contacted your doctor and the conversation you had in order to get this referral.
Disclaimer. I understand and completely get how difficult this time has been for all those in the medical field. I get how stressful the situation has been with not being paid enough and not getting enough rest hours, all of those things, being constantly overworked and things of that nature. Completely understand that and get that. It is a very tiring experience. Completely understand, get that. And you guys deserve all the props that you guys get, plus tenfold. Not an argument. Now, with that being said, being someone of being a person of color, there's always been a love-hate relationship when it comes to the medical field, as far as I have switched multiple doctors multiple times because of the idea that I did not feel that this particular doctor was listening to me or giving me the things that I needed. So I do understand the intrepidation that comes with the Black community and to going to doctors. I completely get that. I completely understand that. So when I tell this part of the story, it might come off with a twinge of still a little bit of anger or upset, but at least want people to understand where that necessarily is coming from, but also understand that I'm also trying to balance that out with respect and also understanding of the situation. So to begin with, already had a little bit of issues with that particular doctor's office because there were a few other times when during 2020 where I either got sick, maybe had a cold. No, it was food poisoning. Sorry, I got food poisoning, and another one was where I just needed a refill on a prescription. And each of those times in those conversations, each time I had those conversations with them, always turned into a long, drawn out session of me going to an urgent care to get tested for something, or me going to setting up appointments that then get transferred and then get canceled and then turn from, oh, you just need to go to urgent care to then, oh, no, you need to go to emergency. Just to be like, oh, you just have food poisoning. It's like, yeah, that's what I said I had. So already having a little bit of a twinge with this. So call up my doctor, said, hey, I need to speak with my doctor. It's an emergency. I've tested positive for COVID. I need to speak with her.
You didn't say it was an emergency.
Okay, fine. I said I need to speak with her immediately.
I just be fair. You called and said, I would like to speak to my doctor. I tested positive for COVID. And you did not give any other information about, other issues you have going on because you felt like they should look into whoever answered the phone should look at your file and know how important this call is.
Well, okay, fine. I'll give you that. That might be my own personal feeling. But hell, with the job that I work, you can't just call and say, hey, I want to talk about my loan or I want to talk about my mortgage. I'm going to have to ask you some qualifying questions to get into it so I can actually see, regardless if I can actually fix it, change it, do anything about it, or get you to the right person you need to get to. I still have to get that initial information. And so when you call someone, when you call into a hotline or whatever, And they start asking these questions like, hey, what's your first name? What's your last name? Who is your doctor? What's your birth date? You feeling that, hey, they're bringing up my file. They're giving off that air of, hey, I'm looking at what you are. I'm looking at your stuff on file. So when you say like, hey, I tested positive for COVID, it's like, who? Okay, he tested positive for COVID. Oh, I see on his file that he has asthma. Okay, I'm gonna go
I'm
ahead.
gonna just, you know,
And then
if
that
folks,
might
if
be a giant assumption.
no, I'm gonna just say, people who work in the medical field, please feel free to leave things in the comments, because I don't assume that all of my personal information about what illnesses I have pop up in a file where it's like at the very top. Like, I feel like that's in there. Yes, if I take the time to take the file and read through, but because I've looked at, you know, when you go on the little website, it's just not up front that, look, wah, Jasmine has these things. It's in there, but I'd have to dig in there to find it, which I probably wouldn't do in a short call. But you called and they were like, she'll call you back.
Yes, and then it turned into like a she called me that she'll call you back. And then like what, like 30 minutes later, it then turned into, okay, we have to do a Zoom call for the following day or something like that. So then we did the Zoom call, and that was a little bit more confusing, because even though I got tested through the Beaumont Urgent Care on Little Mac, I guess whoever did the test did not upload it to Beaumont.
They outsourced the testing to another testing facility. So when we received the results, they were just in an email to us through that testing facility, and not through our, you know, the office or whatever we use to go through, like their website. So it was
All right.
disconnected.
So it didn't pop up on the Beaumont app, the MyChart Beaumont app. And so talking with the doctor, once again, making assumptions that she has all this information, because I would have no idea that the stuff from my Beaumont, if I went to Beaumont, it was like, oh, okay, and this should all be transferring over. Did not know that. So there was a little bit of a disconnect. That having to get that information back, having to send that information directly to her. She did not know about the infusion. She did not know about the infusion. Did not have a good understanding about it, or what it did, or what it did, or even necessarily how to go about doing it. Jazz was there with me, and she actually had to kind of, you know, explain her and walk her through the process. Like, hey, this is what he needs. It's like, we've already done the research.
Now you're being nice, because what we had to do was convince her that he qualified. So
Yes.
the other thing I want people to know is that it's not simply having this information. You have to advocate for yourself in those conversations with your doctor. Remember, if you are a minority, they're already not really listening to you.
Listening to you. Also, even with like how she's saying you have to be an advocate for yourself, it's even more just not just being regular advocate for yourself. It's like even how you advocate for it. Because I'm pretty sure there's a lot of people who've called and said like, yeah, I heard there was that shot that you can get.
Right.
Or they're not using the right terminology when they're starting to talk about it. You have
Yes.
to be, because they're dealing with so many phone calls, or they're dealing with so many people, that they're just like, nope, there's no shot for that, and just trying to push that
And they,
call
yeah,
away.
they don't have the time to sit there and try to decode what you're trying to say. Think of it as a secret code, right? So essentially, what I'm saying is, when you call your doctor, you need to say, I tested positive for COVID. I started having symptoms yesterday. I have these ailments and whatever else. I'm older, I'm over BMI. And from my understanding, I qualify for the antibody infusion. Can you please provide me a prescription? And I'm saying those words exactly. I don't mean, and I know sometimes we'll call and be like John said, hey, I got COVID. Can I get that shot they giving people? And they'll be like, there is no shot. What are you talking about? Can I get that injection? What are you talking about? There's an infusion. You really need to be very to the point and hold your ground, because even when we said that, Her response was, well, I don't know if he qualifies. He doesn't meet the age requirements. And I said, I called the actual infusion center and they said he does. Can you please provide us with a prescription?
Yes.
And I'm not saying she was being difficult or being dismissive. It's just honestly, you cannot beat around the bush. You have to be clear, you have to reiterate, and you have to know what you're asking for before you even go into that conversation. This is, I'm not big on holding hands. I worked in higher ed. This is not the time to play that game, right? If you have any family member or yourself, especially if you're sick, because that means you don't have the energy, you really need, like, God, I wish, and maybe this exists, but a medical advocate that you can call when you're having some sort of issue and you're a person of color who can advocate for you on those phone calls. I don't mean like in the big way, but like something like this, someone who knows enough, like, like you use a, not a midwife, but
A doula.
a doula, someone who, or someone who can help you through that conversation, because if you don't ask the right way, you won't get it. And I'm
No.
telling you, you see John is doing okay, right? You see he's not gasping for breath. He's able to have his conversation. He's not coughing. We saw it work. You have to know what to ask for. So, sorry. So we
No,
got,
that's
go ahead.
no. That may have been like a little off task, but like no, that is completely honest, and actually, it actually hurts my heart a little bit more understanding that they were so many of us that could have been saved. That could have been, because at one point in time there was a surplus of the infusions in Michigan because nobody was getting them. They had so many of them that they had to ship them away or they had to destroy them because they did not, they expired. But now they're like, having to turn people away,
Well,
or they're
I don't
they're
know if
gonna.
they, I don't know if that part happened. I don't know if they expired, but they
Oh,
did have a surplus.
yeah.
You can Google it. Google antibody or antigen. I think I was looking up antigen, but infusion, Michigan. And you'll find information. Just so you know, I'm like this again. This isn't like boil some lemons and breathe it. It's real. You have to go to the hospital to get it. So why don't we, kind of skip ahead, because most of the stuff in between that and you getting the infusion, what was it? The next day, you got it the next day.
Yes, I got it the next day.
So they
No,
gave
I got
him,
it the following, because there was that one day where I was trying to like get, because they were supposed to, because after we got the,
yeah, they called us the next day.
yeah, they called
So
us the next day.
what they did is that she put in, because the doctor is within the system that actually has them. She put in the prescription and they just called and said, come in at this time. So what happened when you went to get the infusion?
So when I went to go get the infusion, there was some protocols I had to do. One, I had to go out to the Royal Oak, Beaumont, and then once I got there, I was instructed to call from the parking lot and then follow the instructions from there. So I got to the parking lot. I told the woman what I was wearing, and she told to look out for a woman in a suit, in the PVC suits or whatever. So as I'm outside waiting, trying to stand away from people, and I kind of outside, like, away from folks, this woman in this giant orange suit with the plastic face shield and the mask and the gloves and the boots and stuff like that met me outside. I gave her my ID. We then walked in through one of the doors, but one of the back doors, and gotta also say was feeling a little bit on the this seemed some type of weird kind of stuff. Why they take me through the back room kind of place, but then after we rounded the corner, saw the regular part of the hospital, was a little bit more at ease, and them just explained to me we had to make sure that you are, because you have tested positive for COVID, that you're not interacting with the regular people that are coming in and out of the hospital. One, two, also didn't know, and I didn't tell you this, Jay, that they had security set up in the hallway because quite a few people, once they went in there for the infusion, just decided that hell, they were going to go to the cafeteria and go to Starbucks.
Oh,
so they literally had to set security to physically block people because people just would.
but this is what we're saying while people running the streets like Like they can just trust the folks around them. If you don't care, trust me, no one else does. No one cares. They will go cough into your coffee.
So so they get you back into this room. They explain the situation, what's going to happen. That is an antibody infusion. Is going to be put through an IV. It usually takes about like 30 minutes for them to make the medication. And then it runs for about an hour, hour and a half through the IV. So you're just basically just kind of sitting there, getting the stuff done. They come and check on you, check on your vitals, you know, every 20, 30 minutes or so, just to make sure that you're okay. It was pretty much painless. Didn't have too many during it. Didn't hurt, didn't do anything like that. There was no like soreness from the injection shot or anything like that. Cause like I said, it was just a regular IV. Came home, was a little bit on the excited side because I thought we kind of may have turned a corner somewhat. Cause it's like, all right, I was sick, had something a little bit wrong, but hey, we
And at the time, your symptoms were pretty mild. You were having shortness of breath if you walked a lot, and you were having some chest pain and the leg pain, but it wasn't that bad, right?
Right. At that point in time, it wasn't that bad. Now, the day after, that was something completely different. That was a combination of like probably the worst chest pains I've ever had in my entire life.
You didn't say that.
What?
You never told me during that time that was one of the. You never said that.
Yeah, I did.
Okay, I'm learning something from this interview too. Go ahead.
Yeah, so it was bad, and but could not tell like what was going on. My pulse ox, I think it was down to 87 that day. My heart rate at the highest was at 135, and it just
And
would
you got
not.
winded walking, 10 steps.
It wasn't even. I got winded walking 10 steps. I got winded just standing up and turning around. Putting on a shirt was, too much for me. And coming to like realization that hell, this might be it is a hell of a thing to do because you're still trying to like, keep like, nope, I just got the infection. And they said like, hey, you might have some dizziness, some confusion. Started mixing up words, couldn't remember things. You start having like some confusion, some dizziness, some more muscle fatigue, shortness of breath, coughing, diarrhea. All of these might be necessarily symptoms of the infusion. And so now that's just another extra layer of symptoms that you're also looking out for on top of the other layer of symptoms from COVID that you're looking out
And
for.
most of those are things that they're like, if you experience, go to the hospital.
Right.
So then we had to call his doctor again.
Yes. Had to call my doctor again, which she never called. Oh, no, she did call back.
Called
She
you
did call.
back because she's the one who told you
To go to the hospital. Yeah, if my oxygen level went back down under 80%.
Or if your chest continued to hurt,
90%. Yeah. Yeah. But she ended up giving me a call back, and I kept still having like that really horrible pain in my chest, and I just couldn't take it anymore. And we decided to go ahead and go down and went to the hospital.
Just so you know, he went by himself at night, and then I got to spend several hours in sheer hysterics, just completely losing my shit. I just want to say, if you are on the fence about getting the vaccine, if you are on the fence about staying in the house, I cannot explain the feeling of not knowing, but really knowing that there's a good chance that someone you care about deeply may die. And I just really challenge you to think about that when you are going out. You don't want to wear a mask, you want to go socialize, you want to go to this party, you want to do whatever. I want you to think about someone close to you and living with that I can't even, like, I don't even know if it's worse if it's sudden. It was 2 weeks of me just being in a sheer panic that John was going to die. I want you to apply that to someone in your life and tell me that you think it's worth going wherever it is you're trying to go or doing whatever it is you're trying to do. And you can come and tell me, don't shame people for wanting to live their life. I was about to say something real, real inappropriate about what they can do with their mouth, but I'm not going to say it. Go ahead. Go ahead and continue. Go
Jeez.
ahead.
So, um, yeah, finally got down to the hospital. Um, yeah, I ended up dead driving by myself only because I knew this is not my first rodeo at the hospital. This is not my first time being there because of my asthma or being because of breathing or chest problems. So for the most part, I have an understanding of what's going to happen. What's going to happen is that I'm going to go in, I'm going to give them my ID, my and my insurance card and all that kind of stuff, fill out that information. And they're going to take some vitals and they're going to hook me up to an EKG. And after they hit me up to an EKG, they're going to go ahead and take some blood. After that, they're going to say, "How we're going to need to do a chest X-ray just to make sure there's no damage or fluid or anything like that." Do that. They might end up giving me a breathing treatment or a steroid.
We
And
forgot to mention that one of the things that your doctor did was send a steroid,
yes,
which I
yes,
think helped to really clear up that gurgle in your lungs, that fluid, that
yes.
pneumonia. Mm-hmm.
Okay. Yeah, I forgot about that. So yeah, so those are the things, and those are like necessarily steps that usually happens with those kind of things. Depending on what the outcome is, usually it goes from, hey, here's some steroids in a Z pack. You can go home, but you need to stay in bed for the next 3 days. Or you need to be admitted because it's a lot difficult. It's a lot more difficult than what it is. And I'm going to be in the hospital for 3 or 4 days.
And my
This is
fear
very,
was he was going to be admitted and never come home because not that people don't come home after they're admitted, but it's just when I say I had a plan A through one, I was out of options. That was it. I had no more backup plans, and there's nothing I could do if he went into the hospital. Part of me was like, maybe it'll be good because someone can care for him, and the other part was like, that just ups the chances of mortality,
all right.
morbidity, death. To put it in
So,
my words.
so I didn't want Jazz to come because also she wouldn't have been able to do anything. She wouldn't have been able to come in here and sit with me, or she wouldn't have been able to. So she would have just been sitting in the parking lot by herself at night. And I'm like, we're in Grosse Pointe. I don't think anybody is going to be doing anything. I don't believe that they would, but I don't want to, I don't want to put her through any extra stress on top of anything else. And I would hate to be in that type of emotional state, but then still have to remember that, hey, I still need to act a particular way because if I don't, I then look threatening. And so I need to like dial that back down. It's like, I don't, so yeah, no, that wasn't cool. So I left her at home. I drove there. And yeah, I was there for,
Like
what was it,
5 or 6 hours.
5 or 6 hours. They gave me an IV. They gave me some more steroids. They did do the EKG. Um, they did, do the chest X-ray. There was no damage. There was no more fluid. They drew
By the
blood.
time you came home, you were feeling better.
Yeah, by the time I was feeling home, I was feeling a whole
And
lot better.
because what they were saying is that basically, and this makes sense, takes a couple days for the antibodies to work. He had just got the infusion less than 24 hours before that. It hadn't had a chance to do anything. What we were seeing was how the direction his COVID was going. Y'all feel me? So, this is what would have continued to happen and gotten worse with COVID. I really believe, and I'm just going to directly say, Ebony, thank you. Because the information she gave us, I am almost positive saved his life. I'm sorry, John, go ahead.
No, like that's 100% accurate. I feel the same exact way. I feel very lucky and blessed to have such people in my life like that.
I'm a little teary-eyed. Hold on. Y'all don't understand. That was frightening. We've only been married like 2 years, going on 3.
Mm-hmm.
And just for reference, why I'm in such a negative space, in 2019, around my birthday, my mother's apartment burned down and she almost died. The fire just about reached her. It was in the news of them carrying her out. In 2020, my dad was hospitalized with Legionnaires, which is rare. Where do you get Legionnaires? Where? He wasn't in an air conditioning tank or some weird pool of water. Don't know. So I thought he was going to die then. Here's 2021. I'm scared of 2022, to be honest with you, because I get one of these a year. And I don't know who's next. It's either me or Kat, and I hope it's not my sister. So I'll
If
take
it's
it.
going by age, then that should be you then, right?
You're right. You're right. I'm the next. Yeah. Oh, it was my age. Oh no, it's me. Cat's safe. Okay. But it's you don't want to do this. You don't want to live this. And if it has not hit close to you, or if it hit close to you and the person was fine, because mind you, again, I had no symptoms. God bless. God bless, because I needed all of my facilities to get through this. But as someone just told me, just because you don't have symptoms this time doesn't mean you get it the second time and you're gonna have the same rodeo. The variants, all of that makes a difference. But I understand now, after seeing the infusion work, why it has to be within 10 days of getting your symptoms, because it may not, it stops it in its tracks. It stops the damage. So, yes, there's still a couple things going. But I would say, John, what do you, in terms of percentage, where do you think you are?
Well, I'm not back at 100. I'm definitely not back at 100 just yet. But I am on the positive passing this grade level. So I might be at a high C, a high C plus, a low B minus right now.
Okay.
Looking at like 79, 80%. You know, my asthma is a little bit more fluctuating right now, but it's still not out of control. It's still within not great parameters, but I'm still like kind of keep an eye on that. I'm not having any more like the muscle pains or the muscle fatigues, but I'm also not trying to push it, too far. Um, Still a little bit like I still have some tiredness though. I'm not gonna lie, I still do have some overall uh, tiredness when I move around or I'm doing a lot of stuff, but it's nothing like how it was beforehand, which
Yeah.
I don't know and can't imagine going through this just full on, just full on, just with no help, like not going to the doctor, not going to the hospital, not getting any type of medication, or being in a place where you're isolated and you're by yourself and you like I don't know. Even if it is something as simple as um our sister-in-law, Kat, my mom, my grandmother, just bringing food, pops bringing like some food by, just so like I didn't have to cook or Jazz didn't have to cook, because that was one more thing that she's not worried about or like concerning herself with while she's sick, but also trying to like keep an eye on me and making sure that my breathing is fine, but then also being on my end like, okay, yeah, I'm sick, but I gotta make sure that she's okay and that she's um also not, that she's also taking her
I'm only
meds and all of you
mentally damaged. It's
and all
fine.
your vitamins, that you forget to take your vitamins sometimes.
I I do, because I'm looking at the time. I don't want this to be too long. I want to get to the part of recommendations. Again, we are not medical professionals, but I will say there's some things that really stuck out to me. As John said, he's had asthma his whole life and it's been in different stages of control. There's been times where his asthma has been very out of control. What, just really quickly, what is it like when your asthma's out of control?
Oh, when my asthma is really out of control, like super duper out of control, the littlest things can necessarily set me off. If I'm standing out somewhere and some dust goes by and it cups up, like, start hacking and coughing, that can like offset it. Moving too fast. Um,
And when you
'Cause
say offset, it means you're using your rescue inhaler multiple times a day.
right,
And
right.
you're taking breathing treatments like every day.
Hmm.
So about, I would say a year or so ago, we really got John's asthma under the control so that he, instead of taking a breathing treatment every day, he's taking them maybe 2, 3 times a year.
Yeah, actually, maybe once a month, depending on like what's going on
Mm,
in the situation, like doing stuff in the basement because I do still
yeah.
have asthma triggers that are not just physical or do have asthma triggers that are physical and environmental, like dust and pollen and those kind of things. And some of those things are a little bit more easier to deal with and to manage. But yeah, my asthma had been on great control. There have been many a times where I left out the house and did not have my inhaler, and then did not realize I did not have my inhaler until I got home. I was like, oh, there it is. There it is on the table.
But what we realized was that his asthma being under control helped us greatly.
Yes,
Like it,
yes.
and what I'm saying is your starting point when you get COVID, regardless of what you have going on, makes a difference. Yes, there are people who are in perfect health who COVID ravaged, but I also want to point out that if they weren't in perfect health, they may not be here. So the thing I'm going to say to everyone, regardless of any ailments or anything you have, is do anything. When I say do anything, that list of things that people say to do for good health, get 8 hours of sleep, drink water, eat vegetables, take a vitamin, exercise. I understand in real life, nobody, not nobody, but a lot of us have struggled to do all of those things. So, what I'm saying instead is do any of them. If the only thing you can do is up your water intake, if the only thing you can do is eat one, a chewable multiple vitamin on the way to work, the only thing you can do is stop smoking. If the only thing you can do is cut out sugar, it doesn't matter because all of those things can make a difference between you surviving and yeah, you might struggle and you not surviving. And I really am asking folks because what I know is that we're in a, like I said, individual culture. I think we all know of a person who was diagnosed, probably even symptomatic, and still going out and doing things. So the only thing we can do is prepare, which is
And
why I'm saying we're getting vaccinated now with the infusion. John
I do
has to
have,
wait 3 months, right?
yeah, I do have to wait 90 days before I can get it
It,
because they don't interact well with each other, apparently.
But I also want to throw out there, folks have this understanding that if you get COVID once, you good forever. They're saying that the immunity is only 3 months, and that doesn't keep you from getting the variants. Which again, that variant can be the difference from last time you had the sniffles and this time you're in the hospital or worse.
Right.
So the first thing I would say is do anything that you can do to get your, take your medication every day.
I want to kind of piggyback on that one um, about doing whatever you need to go ahead and do. Because one, I do agree. I do greatly agree. However, I feel like you need to put a little bit more care into doing whatever you need to do. Um, Jazz did a whole lot of research, a whole lot of research from type of medication, not medication, type of medications that I was using, already taking, prescribed to me from my doctor, to making sure that it didn't have counteracting the things that she was giving me, like the teas or the vitamins, weren't doing weird things. Like if you're taking blood pressure medication, you can't eat or drink grapefruit because that does something weird with the acid or something like that and messes with your stomach. So just doing all those kind of things. But then looking at the symptoms that you're having, um, the tightness in my chest, because I already have asthma. So because of that, that means that all the medication, all the herbal medication that Jazz was giving me was mostly specifically to support respiratory health. The dandelion greens, helping me like cut down on like taking the dairy out of my diet, help me cut down on the inflammation and the mucus that are staying in my lungs. So yeah, if you are experiencing some COVID-like symptoms, but you're like still kind of waiting, or you're kind of like trying to power through it, yeah, there's a lot of things that you can do that are not that expensive, but it is going to require some due diligence and some
Yeah,
research
because
and trying to find this information.
I think you make a good point, because it's important to know before you start taking things how they interact with not just your other medications, but with other illnesses you have. So, for instance, I have gallstones. There's certain teas that I've purchased that I cannot drink. So, it's kind of in my family to do that type of stuff. So I kind of already know a little bit. I'm not telling people not to, but look for things. I should have brought all the vitamins in here, but um, anything that supports lung health, dandelion greens and dandelion tea is one of the things I did. Yes, you can buy dandelion greens, or when you see the dandelions growing outside and a little leaves, that's it. That's it. And I'm not telling you to go pick them. I don't know the pesticides. We got backyard cats. They pee on them. I ordered them from Whole Foods. But, and I also, real quick, because I'm looking at the time. I do want to acknowledge something very important here, and that is privilege. Even in this situation, the privilege we had, but recognizing the privilege other folks have. The privilege I had is that I know people. I went to a good high school. I went to college. I know people who work in the medical field. That's the first thing, that I know people who work in the medical field who can give me this information. I have the wherewithal to navigate this system. That in itself, like I said, knowing what to say, I'm not kidding. When I went through the list of vitamins we were taking, because she's like, well, do you have zinc? Yes, we're taking this. I can't even remember the amount of zinc. Are you vitamin D? Yep, we're taking that. D3. Yep, we have vitamin C. Yep, we have all these other things. And she asked me literally, was I a medical professional? You have to be able to interact almost in that way. But it's also the money. I had the excess funds to immediately order the things we needed and order groceries to the house from whole paycheck, aka Whole Foods. Y'all know it's not cheap, but I also felt like I always think about something John told me once. You know what I'm about to say, right?
God, really?
He told me one time, baby, put lotion on your whole body. We can afford it. And that really stuck with me, y'all, because I'm so cheap. I ain't lotion my whole body. And now I do, and I'm soft and smooth. And that is what I thought about when I placed this order. Because I said, this is not the time to be cheap. I need the best quality everything. I made chicken noodle soup with young farm raised, what do you call that? Free range chickens. They had their own Netflix account, whatever. But I understand that all of that is privilege. Access to health care, good health care, not a free clinic that's overwhelmed. And I'm not going to tell y'all some of the things I had in the back of my back pocket of strings to pull, because what I did know was my husband was not going to die with me just being like, well, I tried one thing. Please no, I will pull every string that I can find. But I recognize that as privilege. And that is why I'm saying to folks right now, the three things: take care of yourself, right? Take care of whatever ailments you have. Do what you can do. Know how to talk to the doctors. Be your advocate. Two, stay the hell in the house. Stop gathering. Don't invite anybody. Keep in mind that I have no symptoms. And if John hadn't tested positive and I didn't know I was exposed, let's just say I was living by myself, you would have invited me over. Jasmine's safe. She don't go nowhere. She don't do nothing. She's scared to go sit in a restaurant. And I could have brought you COVID. Think of that shit. And it don't have to be me. It's literally anybody you have over. And number three, I know people iffy about this, but I know now what we about to do. Get vaccinated. I never in my life want to experience the fear that I had in that moment. We getting vaccinated. So y'all can, whatever you want to do, we getting vaccinated. But we also stay in our ass in the house, because the variant is still out there. And those variants are worse. People are really dying from that. Young people under the age of 21, the folks who everybody was like, well, it's just the older people. It's not. It's not. So if you want to see me, once we are vaccinated, and we can sit outside and space apart, unless you're vaccinated too. But y'all not about to, because I ain't doing this again. I'm not. I'm not. I honestly don't know if my heart will recover. I don't know if my body will recover from the amount of stress I had. And 2022 better not do this to me, Lord. Um, I just went off. I had to get on that soapbox. I'm sorry, John. Um, we're at about the end. I want to hijack your talk. We're at about the end. I want to give you some space to say whatever you have to say about your experience or recommendations or just any final thoughts.
Okay, well, my final thoughts are some of the same things. One, you have to be your own advocate, but you have to be your own advocate. Um, Two, you have to do your own due diligence, and that also has to go with your own being your own advocate. You have to stay up on things. There's been plenty of times where I could have been like, oh well, they didn't call me back today, so I'll let it slide. Like, no, you have to be on them about those kind of things, because although it's sad when they lose a patient and they're sad, but they still get to go home at the end of the day.
That's true. And the squeaky wheel gets the oil, you know?
Right,
Be a squeaky wheel.
right. Um, Also, don't be afraid to reach out, because I know Jazz is talking about like her privilege and talk about the privilege that she does have with it. But I feel that we don't be afraid to use your hookups.
Yes, this is the time to use them.
Don't
You
be
call
don't
every
be
hookup you have.
don't be afraid. Your cousin who did those couple of classes in that nursing class, yep, call her, ask her a couple of questions. That one dude that you used to talk to was from high school that you're cool with, who works at Henry Ford, talk to him. And even if it's just like these like little tidbits of little bits of information can help sway so much more of it. Like, why is it that only the Beaumont hospitals out in Royal Oak and Grosse Pointe, not
Now it's
Grosse Pointe, like
Royal Oak and Troy.
Royal Oak and Troy and Grand Rapids, they're the only ones with this type of medication. And the
None of
one
the
in Grand
hospitals in the city that I understand.
but the one in Grand Rapids might turn you away and tell you, like, that they don't particularly have it. So it's all these like little tidbits of kind of things of information that you have to dig deep on and then try to like figure those kind of things out, because it's not like we had a whole lot of options. So it's it's sad that we have to kind of say these things like, hey, this is what you need to necessarily do, but this is where we are right now. And because this is where we are, these are the steps that we need to take to get over to the next hump. And then once we get over this hump, then we can start working on other things. But you got to be here.
I almost dropped my light.
Oh, okay. But you gotta be here. Um, you gotta be here to do the work. You gotta be here to
Yeah.
do the work.
So, I before, because I know my dad or my mom's gonna mention something about this. I'm drinking champagne. This is out of my intellectual hood rat cup. Because I'm celebrating the fact that my husband is still here. I fought hard. Y'all don't know. I was cooking chicken noodle soup from scratch with dandelion greens. I burnt myself. This is a burn that John is supposed to decorate. Also, if you put mustard on burns, it helps. I put mustard all the way to right here. These burns don't exist. These do. I Y'all don't want to go through this. Y'all don't want to go through this. Lord, I never in my life want to go through this again. So cheers to my husband's health. Y'all, there is no social activity that is worth more than John's health. So y'all won't see me until we are vaccinated. But please, y'all, please take care of yourself. Tell other people to ask. Give them the information that I gave you. You have to be very clear to the point, but there is something out there that can help. It's not guaranteed. I'm still like, I can't tell you when I feel comfortable again of feeling like, okay, we're okay. I can't tell you. I'm still nervous. I'm still nervous. And I haven't been to work in a week. I went in for one meeting. Shouldn't have did that. So y'all don't want to do this. Y'all don't want to go through this. But I'm so happy he's still here, and I wanted to share this information. And we didn't tell nobody. I don't know if you know me. I'm a fairly private person. I don't want everybody calling me in business. So this is our way of telling folks that this happened, but we're on the other side of it, I believe. I
Mhm.
pray, I hope. This was just a journey. This was a journey. And I want to thank folks, anybody who watched this long. Thank you for watching. And the last thing I'll say is because I'm back in the house, I guess maybe interviews you didn't ask for will be back. So if you're interested in being interviewed and you have something you want to talk about, let me know. I ain't got nothing to do. We're doing a photo shoot in front of a abandoned liquor store next weekend, right, honey?
Sure.
All right. Okay. Well, thank you everyone for joining us again for another episode of interviews you didn't ask for with your host, me. And join us next time if I do another one. I think I will. I have some, up my sleeve, where we talk about other things and interviews that no one requested, but I wanted to talk about. Thank you all and have a great evening.
See you guys.